Secondary infertility is defined as having difficulties getting pregnant after you've been able to get pregnant in the past, and it's really common. So when we look at a couple who comes in with secondary infertility, we have to ask the basic questions. Are the eggs okay? Is the uterus okay? Are the tubes okay? And is the sperm okay? And for each of these, there are some very basic tests that we can do. So for example, we can find out if the sperm is normal by doing a simple semen analysis. With 2 or 3 days abstinence, a gentleman will be asked to produce a specimen, and we analyze for the count, the motility, how many sperm or what percentage of sperm are moving, and the morphology, what percent are perfectly normal. If there's a problem, we could have the husband see a urologist and try to figure out what the problem is. And if there's no problem, we could check it off the list and not worry about it. As far as the fallopian tubes, it's not uncommon to have a blocked fallopian tube or even 2 blocked fallopian tubes. That can come from infection, inflammation, or any of a variety of reasons. But we don't know unless we look. So we check a hysterosalpingogram, or an HSG. The patient would go to the radiologist and have dye put up through the uterus, and we can find out if the fallopian tubes are open or blocked. If they're blocked, we can often fix them surgically. If they're open, then we can again check it off the list and not worry about the fallopian tubes. Similarly, we can look at the uterus, and the easiest test for the uterus is to just look in with a transvaginal ultrasound. Sometimes a patient can acquire polyps or fibroids, and they're completely benign, but they can interfere with implantation. Or if there's been a difficult delivery or a cesarean section with complications, we can even have scar tissue. But we don't know unless we look, so we can check with an ultrasound, or that hysterosalpingogram, the HSG, can also give us great information. And lastly, it's really important that we look at the eggs. A woman is born with all the eggs she's ever going to have in a lifetime. When she's in her 20s, 90% of the eggs are normal. By the time she's in her 40s, almost 90% of the eggs are chromosomally abnormal. So we really have to make sure we know whether a woman's eggs are good or average or even problematic. And we could do that sometimes by asking some basic questions about menstrual cycles and family history. Sometimes we can do an ultrasound and look at the ovaries and see how large they are, or check how many follicles, and that's representative of their egg quantity and egg quality and ovarian reserve. And there are blood tests that we could do. One blood test is an FSH, and that measures how hard the brain works at the beginning of the month to stimulate the ovaries by measuring follicle-stimulating hormone. And a newer marker is AMH, or anti-Müllerian hormone, and a great ovary is going to make a ton of AMH, and an ovary that's not as healthy may not make as much. All of these are going to give us clues as to why a couple is having a hard time getting pregnant. If a couple is not able to get pregnant after all the tests are normal, there are still things we can do. There are fertility pills, there's taking the sperm and inseminating them directly into the uterus. There's even higher tech treatments that can be used to help couples get pregnant. In vitro fertilization, for example, can be great as a therapeutic tool. It can fix what's wrong, or even as a diagnostic tool. It'll tell us if the eggs weren't great, if the sperm aren't getting into the eggs, or if the embryos were fine but not sticking. Regardless, we have tremendous success with couples who are coming in with secondary infertility. So even if it's not been easy to get pregnant the second or even third time around, it doesn't mean that we can't help. So in general, by taking a thorough history, by doing an ultrasound, by checking the eggs, sperm, uterus, and tubes, we can often come up with an answer and a targeted solution. And even if we don't have a clear answer, we still know how to fix it, and many patients can complete their family and go on to have healthy pregnancies.